One, two, three, four. Hello, everyone. I would like thanks Dr. Flavia Andrade and Dr. Silvia Mejia for the opportunity to participate in this symposium. My presentation is about the Brain Health Index as a predictor of possible vascular cognitive impairment in the Mexican Health and Aging Study 2012-2015 WAVE. I have nothing to disclose. Ischemic heart disease, stroke, and dementia are leading cause of the death of and disability worldwide, notable affecting aging population. Vascular cognitive impairment refers to a variety of cerebrovascular pathologies that contribute to cognitive impairment. Vascular dementia is the second leading cause of dementia and accounts for up to 15–20% of dementia cases. When compared to Alzheimer's disease and vascular dementia, patients have both a higher cardiovascular burden and a greater level of disability, which in turn led to increased health-related costs. Vascular cognitive impairment are divided according to the level, mild or major. Major vascular dementia is possible to post-stroke dementia, subcortical ischemic vascular dementia, multi-infarct cortical dementia, and mixed dementia. In another hand, possible vascular dementia was defined by the combined presence of a positive history of a stroke and when neuroimaging is not available and clinical significant cognitive deficit in a less one cognitive domain with functional dependence are present. There is limited information concerning vascular cognitive impairment in countries such as Mexico. The Fogarty study analyzed 110 Mexican subjects with a first ever stroke and found 3 months vascular dementia prevalence of 12%. Based on the Mexican Health and Aging Study, a prevalence of 0.6% of possible vascular dementia with an incidence of 2.2 cases per 1,000 person years have been recently estimated. The incidence of dementia has fallen in many countries, probably because of improvements in education, nutrition, healthcare, and lifestyle change. In the Lancet Commission showed 12 potential modifiable risk factors for dementia in the different stages of the life. Hypertension, alcohol, obesity in the middle life, or smoking, depression, or diabetes in the later life. Modifiable risk factors account for around 4% of worldwide dementia, that the potential for prevention is high in a might be higher in low incomes and the middle income countries where more dementias occur. Brain Health Index is defined as the capacity to function adaptability in the environment, with recent definitions emphasis to the need for a broader perspective and not only referring to the mere absence of disease such as stroke or as Alzheimer's disease. The Brain Health Index used in this study was derived from the previous proposal, the American Heart Association Life Simple 7, the Lifestyle for Brain Health Libra Index of the Maastricht study, and the cardiovascular risk factor, aging and dementia, the guided study in the Finnish, to construct the Brain Health Index. For the task, we select factors where derived for the question: has a medical doctor diagnosed you with diabetes, hypertension, or myocardial infarction to determine the level of physical inactivity? For example, the participant had to answer no to the question, On average, during the last 2 years, have you exercised or been engaged in hard physical work 3 or more times a week? Depressive symptoms were considered significant based on the cutoff more than 5, the modified version of the Center of Epidemiology Studies Depression Scale. Obesity was defined as a body mass index than 25, self-reported body weight and weight. Height. History of smoking consisted of a composite score 0 to 2 of the follow question. Have you ever smoked cigarette? And do you smoke cigarettes now? Our research question, in the absence of effective treatment of the disease spectrum, cardiovascular risk factors are a potential target for the prevention of all-cause dementia. This study aimed to establish the association and risk detected by the Brain Health Index as a predictor of possible vascular cognitive impairment in the MHAS 2012-2015. Do you know vascular, the MHAS is a longitudinal core study of Mexican adults than 15 years old. The Brain Health Index considered for the study were diabetes, hypertension, myocardial infarction, depression, obesity, physical inactivity, and smoking. Possible vascular dementia was defined if scored in 2 or more cognitive domains in the cross-cultural cognitive examination or for proxy respondents in the informant questionnaire of cognitive decline in the elderly, EQ code, with 1 or more limitation in instrumental activities of daily living and history of stroke. A multinomial logistic regression model was developed to establish the risks of developing age-dependent variables, dementia, history of stroke, and possible vascular dementia. We use covariables age, sex, and years of education. In this flowchart, you show the sample selection in the baseline in the 2012 and the follow-up 2015 with participants with history of stroke, participants with new stroke, and participant no stroke, and cognitive impairment in the follow-up, possible vascular dementia, and possible vascular dementia with a new stroke in 2015. In this table, we show the participant demographic characteristics in 2015 follow-up. In case considered to have possible vascular dementia, the individual's mean age was 67 years, 35 were female, and the mean education level was 5.80 years. The possible vascular dementia group had a statistical significant higher education level when compared to dementia and the stroke groups. In the dementia groups, the mean age was 74.1 years and 63.7% were female. The history of stroke group have a mean age of 65 and 48% were female. The cognitive impairment group have a mean age 64, 45 were female, and the mean education level was 5.8 years. Finally, the Brain Health Index score in the possible vascular dementia group were 2.6 and 2.9 points. In the multinomial regression model for the brain health index and the diagnostic categories, the model was adjusted for age, sex, and educational level. In case with a higher score in the brain health index, the model revealed a hazard ratio of 1.63 for development for possible vascular dementia. The male sex yielded a hazard ratio 3.7. The model show in the history of a stroke group in the even greater hazard ratio 1.7 for brain health index. Our conclusion. In this study demonstrate that the proposed in the brain health index is useful in determining the risks of developing possible vascular dementia. It also showed that the higher score, the greater risk of developing possible vascular dementia and stroke in Mexican adult age 15 years or older. It's important to underscore that the brain health index model reveals greater risks of possible vascular dementia independent of age, sex, and educational level in 3 diagnostic characteristics studied. Multimorbidity has been previously shown to be independent risk factor associated with mortality among older adults with hazard ratios 1.44. Multimorbidity is defined as the coexistence of 2 or more chronic conditions or disease. Since most cardiovascular risk factors are considered chronic conditions, the development of tools to measure the impact of their coexistence rather than their individual contribution could be helpful to determine relevant outcomes like this case dementia. Finally, of course, our study also has few limitations, retrospective survey, the operational definition of the diagnostic categories. The surveys are not correlated with neuroimaging studies. And finally, the cognitive assessment used in the MHAS does not allow use to identify a cognitive profile among the participants, such as amnesic multiple domain profile, which could suggest vascular etiology with more certainty. Finally, I have to thank my college. And of course, I show you my team in Mexico City in the Department of Geriatric Medicine and Neurology Geriatrics in the Instituto Nacional de Ciencias Médicas y Nutrición, Salvador Subirán. Thank you for your attention.